difficult to catch your breath, and you just can't get enough oxygen. It's a frightening feeling. That's what can happen with asthma. And we need to look at some of the things that occur in asthma to understand it better. First of all, the little airways in the lung have muscles around them, and those muscles go into spasm when they've been triggered and an asthmatic attack is occurring. So it makes the physical airway a lot smaller. Second, there's a kind of swelling that occurs around the airway itself, which makes it even that much more difficult for you to get air because the airway is smaller yet. And thirdly, there's a very thick mucus that blocks the internal airway that's very hard to cough up. And those three together, if asthma is sufficient enough, can be a medical emergency that can be life-threatening. Now we need to look at some of the symptoms that we see, and basically it's wheezing. And the wheezing is on expiration, not on inspiration, and actually the lungs overfill with air rather than underfill. And the problem is getting the air out of the lungs, and that's why it makes that wheezing sound as you're exhaling. The other thing that a lot of asthmatics have is a cough, that typical cough. It's and nothing comes up. It's hack, 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 trying to get that thick mucus in a tiny airway to come up. And of course, the shortness of breath that goes with it. Now the triggers are important for everyone who has asthma, and some people are just really sensitive to certain kinds of things called allergens. Things that stimulate the immune system to make that IgE antibody that causes a reaction in the airways that leads to all the problems that we just discussed. Certain foods, particularly peanuts, things of that sort. Allergies to pets, to dander, to different kinds of pollens. But the lungs themselves are also very sensitive. Even cold air can trigger asthma for some people. And there's something called exercise-induced asthma, so that people who are athletes, when they start exerting themselves, they get a bronchoconstriction and that thick mucus that forms again. Emotional states can cause a problem with asthma. If we get real excited, an acute asthmatic attack can be a real dangerous thing. Then there are people who have GERD, the so-called gastroesophageal reflux, which means that the stomach acids that normally should stay down there are not contained there anymore because the opening between the esophagus and the stomach won't close. And so when there's peristalsis of the stomach, particularly at night, when you're in bed and you're laying flat, it doesn't take much to push the contents of the stomach and all of its acidic material to go up the esophagus and actually back into the throat and be inhaled into the lung. And that can cause, as you can imagine, a lot of irritation. And then there are things like air pollution. Big deal. People who live near freeways, asthma is a much bigger problem. And of course, how about those people that smoke? They're almost incompatible. People who have asthma who smoke have a real special problem they need to deal with. There's some people that even have worse asthma during their menstrual cycle at certain times. So there are many triggers that we have to pay attention to. One of the things that's not well accepted and understood in Western medicine is the role of the intestinal tract, the gut, in causing asthma. And it's a very interesting story, and it works in a couple of ways. Think of it this way. We inhale different things that are in the environment, like pollens and grasses and seeds and things of that sort, into our lung. And when they get down into the lung washes out all the material that's there about every 20 minutes if it's healthy. It goes to the back of the throat and we swallow it. When it gets down to the digestive tract, there are kinds of bacteria that live there that are the normal microflora of the gut, things like the Acidophilus and Bifidobacter, that recognize whether something is dangerous to the body or not. So if a pollen comes down, these bacteria send messengers out to the immune system, of which 60 to 70% resides in the area of the gut, and it instructs it, don't worry about it. This is just pollen. You don't have to do anything about it. Just relax. When those bacteria aren't there, those sentinels aren't there, and the messages can get confused. Now, when a serious microbe, say a Pseudomonas or some other terrible bug comes down into the lung, those same bacteria will alert the immune system with chemical messengers called cytokines that say, now is the time, make some antibodies, make some cells that will kill those little creatures because they're liable to hurt you. So it's important to take something called a probiotic if you have any kind of allergy, so that you have enough of these sentinel cells down there so that they can they can give the correct message to the immune system and not get it all fouled up. The other thing that happens is that the permeability, the porosity of the gut lining itself can change a lot when certain kinds of reactions, immune reactions, occur in the gut. So that what will happen is something that we're sensitive to will come into the intestinal tract. The immune system reacts to it. It creates an increase in the pore size of the gut, so that instead of having nice tight pores, those pores get big. And when they get big, they let in big molecules that shouldn't get across that lining. And 60 to 70% of our immune system's on the other side of that boundary. And if it's overwhelmed with a lot of stimulation, it can lose its normal control and start doing things that you don't like making antibodies against yourself, like your own lung or your own joints or some other tissue in your body. So the so-called leaky gut syndrome becomes a big deal and should be tested for, and if present, should be treated, because there are lots of ways, nutritional ways that are safe, that you can reverse that. And there are many articles on this site that you can refer to learn more about the role of the gastrointestinal tract and different kinds of allergies and the role of the leaky gut syndrome. Now, when we look at treatment for asthma, there are many conventional but also complementary alternative approaches to take. The mainstream approaches are generally to use things called bronchodilators, things like albuterol, and there are a variety of inhalers that can be used that can help to offset that muscle constriction that causes those bronchioles, those tubes in the lungs, to constrict and become small. And when you add albuterol topically to those areas, it takes those squeezed down muscles and relaxes them so the airways open up, sometimes just within seconds, and the asthmatic attack can be broken. You can then exchange air. If that doesn't work well, we're looking at things like the leukotrienes that are modified by drugs like Singulair and Accolade and Zyflo. And what they do is they block the reaction, the immune reaction that causes all that swelling and constriction, and it can do it for periods up to 24 hours, and it can make a big difference in the course of treatment. The problem with albuterol and with the leukotrienes is they all have side effects, some of which can be lethal. In fact, there are about 5,000 deaths every year because of these drugs. So they shouldn't be taken as some kind of panacea, even though when you're having trouble breathing, this is something that you'd like to have on hand because it may save your life too. Then there are steroids, and they can be delivered intravenously if the situation is life-threatening or serious. They can be given by inhalation, or they can be taken orally. And very often they're given in combination with things like albuterol because they work well together, and they help block the allergic reaction. And that brings us to another topic that is involved with how you look at reducing the immune hyperreactivity in people's bodies. It can be done by suppressing the immune system with drugs like steroids, or by lowering our exposure to the things that cause problems with asthma or with any other allergic condition. And there are many ways to do that again, you can look through this site and explore, and we'll make suggestions for you as well to see what these things are. And then lastly, in the mainstream, we have things like long-acting beta agonists, things like Ceravent and Foradil, and they can be very helpful. They're long-acting, so you don't have to take them all the time, but they too have real problems by causing deaths, and they fall into that category of 5,000 people every year that are killed by conventional treatments using drugs. So the complementary and alternative approaches would include the probiotics, would certainly include the leaky gut syndrome, and also one last thing, vitamin D. If we're low in vitamin D, our immune system is shifted to be much more receptive to making antibodies against our own tissues and causing things like asthma and hay fever and hives and angioedema, all these allergic things that we see as we're talking about this condition called asthma. So we should be looking at ways of measuring vitamin D and making sure that they're on the high side of normal, because what they do then is shift the body's tendency from autoimmunity to not autoimmunity by making less in the way of the antibodies that are attacking our bodies. So the combination of conventional and complementary alternative approaches is the mainstream of what we should be looking at if we want the best therapies. But as usual, the best treatment is lifestyle. Eat the right foods, get enough sleep, reduce your stress, keep your weight where it should be. Don't expose yourself to toxins in the environment, and have a meaningful purpose in your life. That's the best medicine. And for you, probably some kind of combination of these things, because you already have asthma or someone you love has asthma, and that's what this site will show you. Have fun exploring.